I want to take us now back to New York City, where we are joined by a very busy man these days, the mayor of New York City, Bill de Blasio. Mayor, we never in our lifetime thought we would see the Javits Center turned into a medical facility and a field hospital in Central Park. Are we on top of this thing? Because as a New Yorker, it feels out of control.
Stephanie, you're right. We've never seen anything like this. It feels like the kind of thing you experience in wartime, and I've been trying to get New Yorkers to understand this is a kind of wartime. We have an invisible enemy, but we have to think like we're in a wartime scenario. Look, what's in control, what's been remarkable is the work of our healthcare workers, the work of our first responders, the folks in this city who are fighting every day to save lives. They've been amazing. They've been inspiring. What's been less inspiring is the role of the federal government. We need the supplies constantly to stay ahead of this, to save the lives we can save. And it's been very uneven. And today, to hear the President of the United States essentially insult healthcare workers, that made no sense, saying, maybe they're not taking care of the masks properly. That's unbelievably insensitive to these frontline heroes who are giving their all against an extraordinarily difficult backdrop. So, Stephanie, we need the federal government to just focus on getting us the ventilators, getting us the doctors, the nurses, everything we need so we can keep fighting this war.
Well, to that very point, I want to share what the president said about New York and what the federal government is doing. He said it on Fox earlier today. Please watch this.
New York is really in trouble, but I think it's going to end up being fine. We're loading it up. We're stocking it up, both New York City and state. We're dealing with the mayor. We're dealing with the governor. And the relationships are very good. I mean, you hear it. They would be complaining if it wasn't. So we're getting them a lot of things that they never thought they'd be getting.
What do you say to that?
I say that when they produce, Stephanie, I'll always give credit. And when they don't, I'm going to say it very bluntly, that lives are on the line. So last week, we did get some of what we needed, the ventilators in particular we needed. I've told the president, I've told his whole team, this coming Sunday, April 5th, is absolutely crucial because this thing is going to be much more intense this coming week. And we need to get ready. And we must see more ventilators. We need the medical personnel. I've talked to the president, to the heads of our military about the fact we need medical personnel from the military to come in and provide some relief for these heroes in these hospitals who are fighting a battle like they've never seen in their lives. So, Stephanie, if the federal government steps up, I'll be the first one to say thank you and give them credit. But if they don't, I keep warning them. They have to up their game to stay ahead of this crisis in New York and around the rest of the country.
You said on Sunday that New Yorkers who violate social distancing rules are going to be fined up to $500. Are there that many people violating it? I'm just thinking about the fact that yesterday, almost 13% of NYPD called out sick. Is it a good use of the police force's time to be out there giving $500 tickets?
Look, we don't want to give the tickets, obviously. It's a way of saying clearly to people, you've been warned, you've been educated, now it's time to get real about social distancing and to take it very seriously. Our police officers and all of our other agencies, Stephanie, they're not going to give out fines for the fun of it. They're going to say to people, break it up if you're in a group. If you're trying to play a team sport in a park, you can't do that anymore. You got to practice social distancing. There'll be a warning. If people ignore our officers, then they'll get fines. We do know right now that we've seen, because of the great work of the NYPD, but also what's happened in this crisis, crime has gone down markedly. Our officers do need to focus on protecting lives, and right now social distancing is one of the best ways to protect lives in the city. So yeah, that is where they should put in time and energy. And they don't want to give the fines, but they will if people don't comply.
Let's go back to the police, because as I just said, almost 13% of NYPD called out sick yesterday. If those numbers keep going up, what is your backup plan? What if a quarter, 50% of NYPD just can't show up?
Well, Stephanie, our Commissioner Dermot Shea is every day making the adjustments he needs to. We do see officers starting to come back who had been infected by coronavirus, who went through the whole course of it and now are back on the job. That's going to keep happening. But you're right, we could have a lot of people out. We'll keep bringing in reserves. We'll go to longer shifts if we have to. We'll do more overtime, whatever it takes. We have 36,000 officers, the finest police force in the country. We are going to keep this city safe. We'll make it work.
Are our health professionals being kept safe right now, Mayor?
Stephanie, everything's being done for our health professionals, but that's my point about they need reinforcements. They need every piece of equipment, the supplies when they need it. Again, we have what we need this week, but after Sunday, I can't guarantee that unless we get more help in. But what they also need is reinforcements. I've literally spoken to the Defense Secretary, the Chairman of the Joint Chiefs of Staff. I've said, we need that medical personnel that is in the military, some extraordinary professionals in the reserves especially, who could be called up and sent to the front. This is the front right now in the United States of America. And our military, thank God the comfort is here. That's giving us such hope, but we need more help. These doctors, these nurses, these healthcare workers have been going through hell for weeks. They need to be spelled. They need fresh reinforcements to come in. So again, if the federal government treats this as a war, if the commander-in-chief treats this as a war, which it is, then the reinforcements will go where the need is greatest so we can save lives. That's here. And then as soon as this battle's over here, we should send those ventilators, send our own personnel out to help people in Detroit, New Orleans, wherever it is around the country, because we're all in this together. But for now, the number one battle in this country is right here in New York City. A quarter of the cases in the nation right here in my city. That's the blunt truth.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.